morning, ma'am.
Good morning. Please take a seat.
Thank you po.
Good morning, Miss. Kindly introduce yourself and tell us why we should consider you for this position.
So, good morning, ma'am. I am Johana, a Bachelor of Science in Nursing student from Notre Dame of Midsayop College. I believe I am a strong candidate because I am passionate about patient care, disciplined in performing nursing procedures, and committed to continuous learning. I value integrity, compassion, and teamwork, qualities that I believe align with your institution's standards. I may still be new to this field, but I am eager to learn, adopt, and grow as part of your healthcare team.
So, Miss C, imagine you are handling 5 patients at once. How would you prioritize care?
So for me, ma'am, so if ever, ma'am, that I am assigned with 5 patients, I will do the triaging. So I use the ABCD principle, the airway, breathing, circulation, and disability exposure to determine who requires the most urgent care. Critical patient will always come first, of course, then followed by those needing time-dependent treatments, and finally those stable enough for routine procedures. So, in addition, effective prioritization and teamwork are vital in ensuring patient safety and proper care delivery po, ma'am.
Okay. Suppose you administer the wrong medication but you realize it right after. What will you do?
So, ma'am, I immediately inform the physician and charge nurse, monitor the patient closely, and document the incident truthfully, or I will write a IR for it. And I believe in accountability and transparency. Hiding an error only puts the patient and my integrity at risk. So, owning up to my mistake is part of being a responsible and ethical nurse po.
Go.
So, what if a patient refuses treatment ordered by the doctor? As their assigned nurse, how will you handle this situation?
So, for me, ma'am, I'd first listen to the patient's reason for refusal to understand their perspective, of course. Then, I'd try to educate them about the purpose and possible effects of the treatment while showing empathy and respect. If they still refuse, I document it accurately and report the incident to the physician and nurse in charge because I respect patient autonomy while ensuring proper communication in the healthcare team.
Okay, how do you handle ethical dilemmas? For example, when a doctor asks you to do something beyond your legal scope as a nurse.
So, I would respectfully decline and explain that the task is beyond my current scope of practice as a nurse. Then, I report the situation to my clinical instructor or to the charge nurses. Then, patient safety and professional ethics must always come first, even when it means standing firm in a difficult situations.
If you were to describe yourself in one word as a future nurse, what would it be and why?
Resilient, because resilience allows me to stay composed and focus under pressure, learn from challenges, and keep going even when situations become overwhelming. It's what keeps nurses grounded in their purpose, to serve, to care, and to endure.
Go.
So, well said, Miss C. Now, do you have any questions for the panel before we conclude?
Yes, ma'am. May I ask, what qualities do you value most in newly hired nurses in this situation?
That's a very thoughtful question, Miss C. Here in our institutions, we don't only look for intelligence or skill. We look for resilience and perseverance. Nursing is not an easy profession. You will face exhaustion, pressure, and emotional strain. But as a nurse, we who can stand firm, stay compassionate, and keep learning despite challenges. That's the kind of the nurse who thrives and grows in the field.
Thank you so much po, ma'am.
Congratulations, Miss C. Thank you for coming today. And keep posted for the result of your interview.
Thank you po, ma'am.